Ovarian cancer is shrouded in myths and misconceptions, leading to a lack of awareness among both women and healthcare professionals about effective prevention and early detection methods. With advancements in science, we now have the tools to detect this disease early and in some cases prevent it altogether to significantly improve survival rates. This video is essential viewing for anyone with a family history of ovarian cancer, anyone with ovaries, or anyone who cares about someone with ovaries. Join me as we dispel myths, spread awareness, and empower you with life-saving knowledge about ovarian cancer. Genetics. Let's first talk about the genetics of ovarian cancer. It's important because about 20% of ovarian cancers are caused because that person has inherited a genetic variant from a parent. You might have heard of people describing this as have inherited a gene mutation or a faulty gene. The most common genes involved in this are BRCA1 or BRCA1 and BRCA2. If you have inherited a harmful copy of one of these genes, we medically call this having a pathological variant. For patients, this can mean your risk of ovarian cancer might be up to 60% in your lifetime. BRCA1 and 2 are not the only genes which are linked to ovarian cancer. There are other genes which are less common and they all carry slightly different risk levels. Angelina Jolie, she famously shared her story of finding out about her BRCA1 mutation in 2013 in the New York Times. I think she really did help to open the conversation around genetic screening for lots of women. She had sadly already lost her mother, who had been diagnosed with breast and ovarian cancer. Angelina Jolie chose to have risk-reducing surgery. Since then, many other women have followed in her footsteps, talking about their genetic mutations and surgical decisions, such as Christina Applegate, Sharon Osbourne, and some not so close to Hollywood like me. So who should have genetic screening? I want to share the words of Dr. Mary Claire King. She is the scientist who first identified the BRCA1 gene in 1990. She says, "To identify a woman as a carrier only after she develops cancer is a failure of cancer prevention." I couldn't agree with her more. Despite the passing of decades since the discovery of the BRCA1 gene, far too many people only find out they carry a gene mutation after a cancer diagnosis in themselves or someone they love. Over 95% of women who have inherited a harmful variant in BRCA1 or 2 are undiagnosed in the UK. That is hundreds of thousands of people who don't know they are at high risk of cancer. Ovarian cancer, breast cancer, and more. I am extremely fortunate to have been able to access private genetic screening, and I am passionate now about bringing this option to more patients. I'm really proud we are able to offer this at Coyne Medical. We can take a simple sample in clinic, and after talking through the options, we would usually then test for multiple cancer genes, which are linked to several cancers, including ovarian, breast, colon, and more. We only ever test for genetic changes, which if they're found, we can then give patients proactive steps to reduce their risk. That could mean recommendations for extra screening or checks or surgery like me. But I know it's not an option for all patients. So I was really delighted that in March this year, NICE recommended the NHS testing guidelines were updated. They now recommend that anyone who has a family history of ovarian cancer in a first or second degree relative to be considered for genetic screening. A first degree relative is, for instance, a parent or a sister. A second degree relative is much broader and includes grandparents, aunts, nieces or half-sisters. This includes relatives on either mum or dad's side of the family. So if private testing is not an option for you, do speak to your GP about the new guidelines. In the past, it may be that you were even denied testing on the NHS, but could now be eligible. What if you don't have any family history of ovarian cancer? Yes, you can still have genetic screening. Traditionally, we only screened patients if they fitted our high-risk family history criteria. We now know from large studies on breast and ovarian cancer that if we only use those family history criteria, we will miss over 50% of people with a pathological mutation in BRCA1 or 2. So if you really want to get serious about optimising your cancer screening and prevention, we think that genetic screening is crucial. You really don't want to be one of the patients that only find out after they get cancer, knowing that perhaps you might have been able to prevent it or diagnose it earlier. Personally, I know the truth behind those statistics. I tested positive for a pathological variant in a gene called PALB2 in 2021. It puts me at increased risk of ovarian cancer and breast cancer. I did not meet the traditional criteria for genetic testing and would not have known about it without choosing to have private genetic screening. I feel incredibly lucky I found my gene mutation while I was completely healthy instead of after a cancer diagnosis. I have been able to join Angelina Jolie in choosing to have preventative risk-reducing surgery. To know my own risk and then be able to take action to reduce that risk feels like a really special gift. I would love to see more women sharing this. Could a family history of other cancers be linked to ovarian cancer? Yes. Many of the genes that increase the risk of ovarian cancer are linked to other cancers. So if your family history also includes breast cancer, pancreatic cancer, or prostate cancer especially, those are all flags that you have a higher chance of having inherited a gene mutation. And we would certainly encourage you to consider genetic screening. And this doesn't just apply to women. We would also encourage men with a family history of these cancers to think about genetic screening. Finding a gene mutation will not only help their health and help us manage their risk and cancer screening, but it will also potentially help their daughters, granddaughters, nieces, sisters. Another common myth is that it doesn't matter if there's no family history on the mum side of the tree. Wrong. You can inherit these gene mutations from either your mother or father. In fact, women who inherit from their dad are more often missed. Men are much less likely to get breast cancer and certainly can't get ovarian cancer. So for those men's daughters, their family history often doesn't appear very worrying. The same can be true from people from very small families. You can imagine a history of cancer in a grandmother or aunt on dad's side is often not thought to be as concerning as a history in a mum or an aunt. I would encourage everyone to find out the most they can about their family history. During the dark days of the first COVID lockdown, I started researching my family tree, which has been fascinating. But after I discovered that I had my gene mutation, I then searched in much more detail and tried to find out what people had died of. I actually got a copy of my great-grandmother's death certificate. This showed that she died from breast cancer in her 40s. It really very likely that I almost certainly inherited my mutation from her. So it shows the importance of talking to relatives if you can, or if not, using the wonders of the internet and modern research to be able to know a bit more about your history. Of course, we're focused on ovarian cancer in this video today, but family history of all cancers, as well as other diseases such as heart attacks, are also really important information for you to have. Do you have any Jewish ancestry? Having a parent or grandparent of Jewish ancestry is a big risk factor for inheriting a BRCA1 or BRCA2 genetic mutation, up to a 1 in 40 chance. We would recommend all people with these risk factors use genetic screening. The NHS has actually recently started a project offering testing for gene variants in only the BRCA1 and 2 genes, as these are the most common ones to be mutated in people of Jewish ancestry. If you're interested, you can find out more about the project online, and I'll put the link in our notes as well. How does finding a high-risk ovarian cancer gene help you prevent cancer? So some women who find they have a gene mutation will opt to have their ovaries and fallopian tubes removed, especially if they have completed their family, or certainly if they've already entered the menopause phase of life. You could say they are no longer serving any real function or purpose, apart from adding to that person's cancer risk. The decision can be much more difficult for younger women. For younger women, surgery will bring on an early menopause and impact on their choices for fertility. It's important that women in this scenario make sure you get the best advice on which option is the best for your health and your family. There is a brilliant UK study called Protector. It is led by Professor Ranjit Manchanda, who is a great advocate for increasing access to genetic screening for all women. The study offers women the option of removing the fallopian tubes only and keeping their ovaries. This will then usually be followed by removal of the ovaries at a later date. We know many ovarian cancers actually start at the end of the fallopian tube, very close to where it meets the ovary. The study wants to show this option can help women who wish to delay their surgery. So this option could help reduce risk without the negative effect of menopause in younger women. Both surgical options are big decisions and need careful thinking through the pros and cons so each woman can make their own best decision for their health. Can I do anything else to prevent ovarian cancer? Yes, there are lots of factors that we can control that will reduce your risk of ovarian cancer. The great thing is they will often also reduce your risk of lots of other cancers such as breast and colon cancer. Keeping a healthy weight and not smoking are two of the biggest factors that you can keep in check. The combined oral contraceptive pill can also reduce risk, even if actually only taken for a short period of time. The protection from taking the pill also persists. So what we mean is the positive benefit continues for several years after stopping the pill. For high-risk women though, such as those having a BRCA1 or BRCA2 mutation, the combined oral contraceptive pill increases the risk of breast cancer, so may not be a suitable option for that group. Breastfeeding is protective for ovarian cancer risk, with a 24% risk reduction. I know personally breastfeeding can be really challenging, certainly the hardest part of life as a new mum with my first baby. So I'm really conscious of not adding to the mummy guilt around breastfeeding with this. But if you have a family history of ovarian cancer, it is good to know that this choice could have a positive impact on your own health too. Having children, i.e. a pregnancy, reduces the chance of having ovarian cancer. Of course, alone, not a reason to have a baby. There's been a lot of concern about using talcum powder, especially in the genital area and ovarian cancer. The evidence on this scientifically has been quite mixed, but it's not essential, so it does seem sensible to avoid this. So now let's think about early detection, because for those cancers we can't prevent, we need to diagnose them as early as possible. Early diagnosis is vital. Sadly, 2/3 of women are diagnosed at a late stage. If we can diagnose women early, remember, at stage 1, the survival rate is over 94% at 5 years, versus only 16% for women diagnosed at stage 4. So how can we screen you for ovarian cancer and detect it early? For women who do not have a high-risk gene mutation, we don't actually routinely recommend using screening such as ultrasound or the blood test called CA125. And that's because the biggest UK trial didn't show this could improve a chance of women surviving ovarian cancer. They studied over 200,000 women over about 16 years, split into 3 groups: no screening, screening with an ultrasound scan, and screening with an ultrasound scan and the CA125 blood test. The results did show women screened with the ultrasound and CA125 blood tests did seem to get their cancers diagnosed at an earlier stage. But sadly, they couldn't prove in that study that this saved a significant number of lives to recommend it for screening for the population. We do know the CA125 blood test is not perfect. It can give a lot of false alarms because other conditions like endometriosis or fibroids can cause high levels too. But the results of the studies have been different in women who are high risk, such as those with a BRCA1 gene mutation. They are now recommended to consider regular screening with the CA125 blood test and are using a special algorithm to monitor their results called ROCA. The test has been available privately for the last few years, but this is a new recommendation that they have recommended it should be available on the NHS in 2024. It's not yet easily available nationally, but hopefully this will change soon. The ROCA test has been shown to detect ovarian cancer earlier before symptoms appear. For high-risk women, they can have this done 3 times a year. The results will be tracked, and if a significant increase is noted, this will prompt more tests and checks. This might be a good option for high-risk gene carriers especially to consider if they're in the group that have decided against surgery or are waiting perhaps for surgery to be done at an older age. Are there any other ways of screening for ovarian cancer? Yes. We now have a new blood test that can be used to screen for ovarian cancer. It uses a normal blood test sample taken in our clinic, and then the laboratory look for circulating tumour cells called CTCs. When a cancer or tumour starts to grow in the body, some of the cells from that cancer will get into the bloodstream, called CTCs. The really exciting part for detection is that these happen even in very early stage 1 cancer where there's been no spread. The blood test is called a multi-cancer early detection test. We offer a test called TrueCheck that either focuses on female cancers, including breast and ovarian cancer, or offers a multi-option where we screen for up to 70 solid organ tumours. We offer this test at Coyne Medical, but we're careful to always offer it with a full consultation with the doctor to understand the test and if it's the right choice for you. We also always want to make sure that patients are up to date with their standard cancer screening, as these newer kind of tests should be seen as a great optional add-on rather than a replacement. Likewise, we also use whole body MRI scans as an add-on cancer screening tool. These scans from head through neck, chest, abdomen and pelvis. In the pelvic area, they could detect things like cysts or fluid, which could indicate an ovarian cancer. In large studies of tens of thousands of patients of whole body MRI, the rate of detecting a cancer was actually 1 to 2% in healthy adults over 40. But we know this has to be balanced against the risk of finding small abnormalities or false alarms, which can cause stress and need further checks. That's why it's important, if you're going to choose whole body MRI, you go through those possibilities with your doctor before testing, as well as making sure your doctor is there to support you through the results and any follow-up. Myth. A smear test checks for ovarian cancer. This is sadly a really common myth. About 1 in 4 women think this is true, but sadly it's not. Cervical screening will not detect ovarian cancer, though it is a really important cancer screening, so do make sure everyone is up to date with that. Knowing the symptoms. It's key for every woman to know. Symptoms to watch for include a persistent increase in tummy or abdomen size or bloating. Not bloating that comes and goes, but really is quite persistent. Persistent pelvic and abdominal pain. Unexplained change in bowel habits. Difficulty eating and feeling full very quickly or feeling nauseous. Needing to urinate or pee more often. Other symptoms can include tiredness, losing weight, pain during sex and back pain. All of these symptoms can be symptoms of many other conditions too, so don't panic, but you should see your doctor. Depending on your symptoms, they might want to check that CA125 blood test, and you may need an ultrasound scan as well. Knowledge is power. Yet many women and doctors are not well informed about ovarian cancer. A study by the charity Target Ovarian Cancer found that less than 5% of women felt confident recognising its signs. And surprisingly, many doctors also mistakenly believed that symptoms only ever appear in the very late stages of the disease. We at Coyne Medical are committed to empowering women with the knowledge they need to make informed health decisions. If you know other women who could benefit from this information, please share it with them. Together, we can spread awareness and equip more women with the knowledge they need. Follow us if you'd like to learn more about disease prevention and early detection.